Hi, this is Dr. Raghu Athre with Athre Facial Plastics in Houston, Texas. I thought it would be an interesting concept to put out some videos about facial analysis and how I end up analyzing my facial rejuvenation patients. So let's dive right in. So here's one of my patients. This is Allie. Allie is 62 years old. Her primary goals are to look about 20 years younger. She's in a very competitive business environment and she just doesn't feel like what she looks like in her face really exhibits who she is and the energy that she exudes. So let's dive in right here. So what we're seeing right here is a frontal view, okay? And one of the ways that I analyze the face is I really like to analyze the face kind of top down. That's just my technique. So let's go ahead and dive into it. So first of all, she's got relative good symmetry from her top, middle, and lower 1/3 of her face. So I think she's good proportion right there. The first thing that I see is this curvature of her brow. Right here, this is my target area. So ideally, the female brow should be elevated a little bit in the lateral portion. So the first thing that I did is kind of played with her brow and saw first the mobility of her brow and what it looked like elevated. And I didn't really like the elevation of her brow. I think it made her look very skeletonized because you can see the bone right here. So when this thing goes up too high, it looks very deer in the headlights type of look. So we said, okay, that's not something we're going to do. So we disregarded that idea. The second thing, as I'm looking at the top third of her face, is this right here. This is her upper eyelid. She's got a little bit of excess skin in that area, not a whole significant amount. She definitively does not have any herniated fat or any pooching out fat in that area. So we said, let's leave that alone, because since she's so slender and she doesn't have a whole lot of volume, if we decided to work on this excess skin, I think the result of this is we're going to skeletonize her upper eyelid even more, and she'll have no tissue in that area, which looks very, very artificial and is going to make her look older, not look younger. So for those reasons, we just abandoned the ideas of both the brow lift and upper blepharoplasty. The next thing that we looked at is her lower eyelid. So I start with the position of the lower eyelid, and she's got great position. Her lower eyelid covers a little portion of the colored portion of her eye at straight view, which looks good. She's got good amount of tightness. The muscle has good snap to it. She doesn't have any fat bags here. She doesn't seem to have any herniated fat. The only thing she's got is a little bit of this crepe-like skin in this area. Now, first stage. This is why we have to customize surgery to every single patient. You can see she's got a little bit of color in her skin. Now she's got some areas of hyperpigmentation, especially I'm kind of marking them out. Her skin is giving you clues that it doesn't like to be messed with a whole lot. So in a Caucasian patient, I would consider possibly lasering this or chemical peeling this. If I did that in her, she is going to end up with some pretty significant hyperpigmentation in this area. And if she gets hyperpigmentation, then she has to wear makeup to cover it up. So we decided we're not going to do that. So what we ended up thinking about doing is some stem cells to kind of enhance the texture and reduce the crepiness of the skin. Now the next thing that I really see is this right here. Let's kind of change the color for that so it's really more prominent, okay? Color change to red. There we go. So this is the transition zone between her lower eyelid and her cheek. You can see this tear trough right there. Now that tear trough is caused by a couple of different things. So number one, she's lost some volume right in that area. That's the first thing. Secondarily, you can see the bulk of her volume on her face, which is sitting right there. That needs to go up. As that has fallen, you're seeing that volume fall down, skeletonizing this orbital rim, and she's lost volume in this area, all adding together to give this kind of very hollow groove in that area. So when we look at this, basically what we see is this kind of tells you the types of procedures I'd like to do. Number one, she needs some fat transfer. I'm going to put the fat right into that lower eyelid region, a little bit in her temporal hollows. Now, she needs a deep plane facelift, which is going to help with multiple things. It's going to move that large mass of mid-face tissue back up to where it's supposed to be, helping the tear trough. It's going to reduce the smile line and sharpen the jawline. So there's where we are right now. Then I look at this area right here. She seems to have a pretty good distance between her nose and her lip. Lip has good shape and form. And then on frontal view, she's got a lot of stuff going on right here. She's got a lot of laxity and flaccidity in that platysmal muscle with some crepe-like skin. So if we're going to put some stem cells into that lower eyelid skin right there, we'll probably put some stem cells into the skin that's very superficial into the skin to help with the texture of the skin. So let's jump now to the 45-degree view. On the 45-degree view, that tear trough is again very, very prominent here. You can see the two bubbles, and what we really, really want is a single contour from the lower eyelid to the cheek. So you can see all this volume that's missing. So we need to lift this up, lift all this massive tissue up, and add some fat right in there, okay? Now, looking further on the 45-degree view, a couple of things kind of pop up. Let's take a look at this area right in. I'm going to highlight it up here for you, this area right in here, okay? Let's look at that. So normally, when I do a facelift, my incision for the temples, I like to use this incision right here, right along the edge of the hairline. Now, the problem in her is that that incision is not going to work for her. She doesn't have a whole lot of density of hair right here. So if we make that incision and she puts her hair up just as she has in this photo, that's going to be a visible incision. So I elected to make her incision way up here. Now, here's the positive and the downside. The downside to this incision way up here, the distance to my target tissue, which is here, is a lot more than it is from here. But cosmetically, this looks way better. So in this specific patient, that trade-off was very important because of hair density. So this brings up a very critical thought. You really have to modify all types of your standard protocol, standard incision, facelift incisions for the patient. This is very, very important. It's not a one-size-fits-all. So when patients send me an email, what's the incision that you use for a facelift? Depends. So I like this incision. However, in this patient, I had to use a temporal fossa incision. The other thing we see on the 45-degree view is you kind of see very carefully, there's a little bit of this pooching out right here, like a little bag kind of pooching out. And we're going to talk about this in a little bit more detail on the next slide. Other than that, you see some very good definition along the jawline. She's got a little bit of laxity, but not too much. And she's got good chin position. All right, let's jump over to that close. Now you can really see, I'm going to kind of highlight here. This is the area we're talking about, and you can kind of see that there is a little bit of a bag or something that's kind of pushing out against those tissues. This right here is your submandibular gland. It's a spit gland. And this gland lives right about here. And as we age, it can sometimes pooch out a little bit. And as it pooches out, what happens is if I do a facelift or a neck lift in this person, and I tighten the overlying muscle over the gland, it's going to further accentuate that. So you're going to have a very nice sharp jawline with this accentuated bubble popping out. And so you're going to have two little shadows there, which doesn't look good. So in her, one of the things that this tells me is I'm going to do a submandibular gland excision or debulking procedure on her. Now, for the purposes of this video, that's kind of a lot to kind of dive into a whole different topic. Please check out one of our videos on submandibular glands. But the reason to do this on her is the fact that I really want a very sharp neck with a very defined jaw and nothing in between to distract from that definition. The other thing that you see is you see this very sharp angle of mandible, which I really, really like, with a lot of contouring underneath it. So we're going to kind of accentuate that in her facelift because I think it looks very feminine and definition there looks good. So moving along, this is actually a picture of the submandibular gland that we debulked. And to give you some proportion size, the size of this gauze is 4 inches by 4 inches. So that's a pretty significant amount of tissue that was living and pooching out, and that is what we debulked in order to get that very sharp jawline contour. So here she is on profile view, and again, this confirms a lot of the things that we've seen on her prior slides. Okay, so here we are, there's that double bubble again with the little groove, and here's the bubble, so this all needs to come up. We can really see that density. If we made this incision, would not really look good, so this incision looks better. We see that little bulb again right in there. So basically on her game plan is a deep plane facelift, deep neck lift, submandibular gland excision, and a lot of fat transfer with some stem cells into that crepey skin of the eyelid and crepey skin of the neck. So I hope this video was useful and you learned something from it and gives you a little insight into the way that I think, how I plan these surgeries, and what I think that you should really get out of this is every facial rejuvenation is an independent surgery. You really need to analyze the patient. There's a lot of modifications. There's nothing that's standard. There's nothing that this is the way I do it every single time. There's some things that I think happen with a certain amount of frequency, like I do a lot of deep neck lifts because I really like sharp, defined necks. However, everything is modifiable based on the anatomy of the patient, what the patient desires, and what I think is going to look best for that patient. So that's kind of the take-home point. I think that people watching this video will really kind of see that it's not a one-stop shop. This type of surgery really needs to be very bespoke, very customized to the patient. And that's why I look at every facial rejuvenation consultation as a brand new day. Let's see what this patient has and how we're going to modify our surgeries to adapt to this patient's anatomy. So I really thank you for watching this video. I hope you got something out of it. If you like it, please give us the like and subscribe, and I look forward to seeing you on one of our next videos.